Well, a warm welcome to this. I think we could say a sort of a follow-up, Kyle, really, because I've actually checked. We last talked, believe it or not, on the 10th of November. It seems doesn't seem that long ago.
Yeah, it's been a long time.
Yeah, but I've had numerous requests for an update on how you're getting on, and the original videos have had several million views. Actually, it's been a lot of people be following your progress. I think what I like to do in these videos really is kind of give a bit of a bottom line, and people can decide if they want to watch it or not. And I
Mm.
think the bottom line is that you've improved quite a bit, but you're not where
Yeah.
you want to be. Is that a fair summary of the video?
Yeah, definitely in a much better place than last time. The last time we talked, I was kind of in the middle of the big reaction, and then the past few months have had a lot of healing. I feel much better, and we've learned a lot as a group as well, just kind of all the injured people coming together. So if people are interested in that, I think it'd be good to kind of pay attention or, tag along. But yeah, doing a lot better.
I think that's an excellent point because the main reason that we're doing this is to try and let people who've had various pathologies and injuries after the vaccines
Mhm.
hopefully learn from your experience, which has been difficult.
Yeah,
That is for sure. Can we start off with a bit of a timeline, Carl, for people that haven't seen the previous videos? If we just go
yeah.
back.
And I think one thing too to mention is that, the a lot of the post-vaccine injury that has been happening, it seems to share a lot in common with like COVID long haul. So the people that are getting really, long COVID and they're having dysautonomia or they're having heart issues post-COVID as well. So it seems like Dr. Yo and Dr. Patterson, they've put it in a way where they said it's almost like long COVID and this vaccine injury are cousins, and they have a lot of shared similarities. So even if someone does have long COVID, I think they can learn a lot. And that's one thing that's been interesting is that the long COVID community and then the vaccine injured community has come together in this way where they've been sharing a lot of resources. And I mean, it's just been full gas for the past 6 or 7 months of people, physicians getting involved and trying to help out. So yeah, I can I can dive into my story a little bit as well
Mm.
for people that aren't familiar, but I think it's interesting just how much they share in common with long COVID or post COVID
I
syndrome as
think that's a
well.
really vital point that there's so many similarities emerging between
Hmm.
long COVID and COVID vaccine induced injuries, and it kind of makes sense because it's the same antigen potentially
Hmm.
that's causing the difficulties. But if we go with your personal story, Carl, just take us back.
Yeah, so for me, I actually got the Pfizer vaccine, and so my first dose was in May, I think around May 14th
This
ish,
is this is
and
this is
then
May 21, isn't it?
yeah, 2021, and
Yeah.
then my second dose was June 10th, and so after my second dose, I would say maybe 2 weeks or so after my second dose, I started developing a little bit of heart palpitations, and just my heart felt like it wasn't working as normally as it does. And I kind of just took it easy for about a week and a half to 2 weeks, just laying in bed and resting, just trying to see if it go away. I wasn't sure what was happening. It felt honestly like a lot of anxiety, but I didn't have more anxiety or more stress in my life than normal. So it was kind of perplexing. I didn't really know what was going on. And then I went out for a mountain bike ride in early July. And on that ride, I just felt really weak and really sick and not feeling the best. And my heart rate went up to about 150 or 160 pretty quickly on the ride within just a few minutes of climbing. And after that, I was really out of breath, got down, down the hill after a little small loop, and my heart rate wouldn't come down. And so it was just stuck at a really high elevated rate. And I thought that was, I mean, concerning to me, but it wasn't the end of the world. I was like, man, this feels so weird. And one of the guys that I was with, Bill, he's in his 50s, and he just looked at me and he said, dude, you need to go to the hospital. This doesn't look right. Like, you don't look good. We need to figure this out. And so that kind of kickstarted this whole journey over the past 7 months or 8 months of going through all the diagnoses, getting diagnosed with pericarditis, which is swelling around the liner of the heart. And then I did have an elevated troponin level as well, which would point to like a really mild myocarditis, but I didn't get diagnosed with myocarditis. I just had the elevated troponin when I went to the hospital. But they did a CT angiogram, they did a cardiac MRI, they did an EKG, CKG, and I just had the pericarditis diagnosis, which is good because the myo is the one that's a little bit more severe. And then along with that, I also developed a little bit of dysautonomia, which is the POTS symptoms, so
Mm.
postural orthostatic tachycardia. And along with that, that was kind of the biggest thing was my body couldn't regulate itself very well. So I'd have runaway temperature fluctuations. I'd be laying in bed and I'd try to stand up and I'd just pass out. And then anytime I was just standing, my heart would kind of run away on me and be in the 130s. And usually my resting heart rate is somewhere around 58 to 60. So it was, my body was just way out of whack. And the only thing that seemed to help early on, like I went through the cardiologist, they put me on something called colchicine for the pericarditis. And I didn't tolerate that very well either. And I developed like some mouth sores and just a little bit of issues with that medicine. For the POTS diagnosis in September, they didn't actually offer anything because they were going to say, well, you could try colchicine again, but you already didn't tolerate it very well. And then I think there's another drug called metoprolol. And I did have to take that for my CT angiogram. And I didn't really tolerate that very well too, because I was already so weak and it basically reduces your heart rate a lot. And so I was struggling to find a medication to help with the POTS. And I was just kind of stuck in this zone where I couldn't really get out of bed much. And if I did, and I tried to do anything, it would just drain my battery so fast. And it would take, weeks and weeks to get back to normal. So that went on, July, August, September, October, November. And then kind of starting in the end of November, early December, I started to feel a little bit better and be up and on my feet a little bit more. But then at that point, I was just like trying to figure out what was going on. And I did a multi-day fast in the end of October. And during that multi-day fast, it was the best I'd felt in quite a while. And so I had a suspicion that maybe there's a food trigger that I was dealing with, because it seemed that after I would eat breakfast or lunch or dinner, then my symptoms would set in a little bit more and I'd be having a little bit more issues. And so I just decided I'll do a fast for a few days. And after that, I felt much better. And I went into an allergist actually, and they started running me through all the different allergy tests. And one thing that was really elevated, actually two things. I had a really high eosinophil level, and then I had a really high IgE level. So the IgE, you can correct me if I'm wrong, but it's the immunoglobulin type E, which is an antibody that reacts to allergens that come into your system. And so my IgE level, like a healthy one, is below 115. And, a high one would be anything above like 150 or 200. And mine was at 883. So I was just reacting to everything. And we started doing a skin prick test, and I was reactive to everything there. And then we started doing blood tests because the doctor's like, this doesn't make any sense. Let's see if your blood is reacting as well. So they did IgE blood tests, and I was reacted to a lot of the foods as well. So that was really interesting. And then they put me on a medication, which I have it here. I messed it up last time we were talking. I called it sodium chloride, but it's cromolyn sodium. And
Okay,
so I guess
right.
this is a mast cell stabilizer.
Yeah.
Mast cell. So they diagnosed me with a little bit of mast cell activation syndrome, or MCAS, which is a common thing that people have been developing both long COVID and with the post-vaccine. And after I got on that medication, that's when in like kind of the end of November and December, I started to feel a little better, but I was still struggling a bit. And then January and February, I did hyperbaric oxygen therapy, which is in a hard shell chamber, breathing, medical grade, 100% oxygen at 1.5 atmospheres to 1.75 atmosphere. And then we touched 2 atmospheres a couple times, but not for sustained length of time. But I did 5 days a week in that treatment. So every morning, 5 days a week for 8 weeks, and did 40 sessions there. And so that was the thing that made the biggest difference for me. And after my probably 15th or 20th treatment, I started to feel a lot more like myself as far as my strength was coming back. I felt like I had a lot more energy. My heart, like the dysautonomia, the POTS stuff was kind of all the way gone. And I was able to start actually working out in the gym a little bit. And then I have an electric mountain bike, and I was able to get out on the electric mountain bike and slowly start building strength. And so the last few months, basically March, April, and I guess now it's May, it's just been like this steady progression of getting better and better and better. And my body feels like it's coming back around quite a bit. However, I do still have an elevated IgE level. The last time we checked it, it was in the low 600s. So it's trending down, and it's trending in the right direction, which is great. But I'm still battling a little bit of kind of autoimmunity or some allergic reaction. And early on, I'd thought that I was dealing with something like a reactive arthritis, because all my joints were so sore all the time. And with the latest doctor I'm working with, we went through and did all the arthritis tests, and I was negative for all the arthritis tests, but I was still battling some joint pain. And then we started looking at this link. I guess there's some data on chronic IgE and chronic allergies with tendonitis, and it can cause tendonitis of the joints. And so that's what we're kind of battling through right now, is trying to get my joints to feel a little better. But I would say I'm probably 80 to 85% back to normal. And the things I'm just struggling a little bit with are like, high intensity. If I go too hard, then I'll have a little bit of a relapse and I'll kind of take a week or two to recharge. And then just dealing with a little bit of the food triggers as well. So I just went on a trip actually last month, and on the trip, I started out the trip eating really strict and staying to my diet really well. And then by the end of the trip, kind of trying to rush home and started eating a little bit worse. And it flared up my skin and I had like a big rash everywhere, and rash on my face, rash on my neck. And I started to just feel like crap again. So the last week and a half, I've just been cleaned up the diet again and getting back on this medication quite a bit. And that's been helping a lot. So we're starting to learn a lot, getting under control. But I was lucky to be one of the people that didn't have a lot of the neurological issues. It seems like with the post-vaccine injury and with long COVID, some people have more of like the dysautonomia and the heart issues. And then some people struggle a little bit more with the neurological issues and the burning and the ringing and twitching and vibrations. And I wasn't one of those people. I didn't have that symptom set, but I had kind of this other one. I feel like the hyperbaric and a few of the other treatments we've been doing has helped a lot.
How are you heart-wise now, Carl? Do you still get any pericarditis pain or heart pain or?
Yeah, I would say I felt like I was getting to the point where it wasn't happening at all anymore last month. So I think my last session of hyperbaric was the second week of March, actually. And after that, I felt like I was not really having any issues with my heart. I could go ride my electric bike, have no problem. I even started riding my normal mountain bike a little bit more as well. And then on this trip, I did a pretty big day 2 Mondays ago. And I think I overdid it. And it was the first time it really had like flared back up again. And I just felt like I had pressure in my chest. And I was trying to figure out, I'm like, I don't know if it's my heart, but it feels like it did before. But it just, it was weird because only on the left side, it's kind of like right in my chest cavity where my heart is. And it just feels like it's trying to get inflamed a little bit. So
And
I guess
going into your left shoulder, is it?
mostly on mine, it's kind of like under my breastplate. And so it's just
Mm.
basically right on the under part here. And so I was dealing with that again, and that took about a week, but now it's starting to get to the point where I feel like I'm not thinking about my heart as much, but I still, it's a lot of mental trauma as well, going through that and just not being able to trust your body yet. I think that's one thing that a lot of us that have gone through this are struggling with, like the trauma aspect of it, because not only having this injury, but then kind of being gaslit in a lot of ways, or having a hard time expressing and sharing with people without it getting pulled in the wrong way. So for me, I still struggle trusting my heart. And I actually had like a pretty bad nightmare 2 nights ago where it felt so real, but I felt like I woke up and my heart was running away on me. And I was like scrambling around trying to find my watch so that I could put it on and see what was happening. But then I woke up and it wasn't actually happening. So there is a lot of mental trauma as well there, but I feel like my physical body is about 85 or 90%. And I just hope that it'll continue to move forward. But what we're working on now is basically trying to regulate the immune system again and get my innate immune system to come back up, because I have gotten sick a lot ever since this happened. I've gotten sick 5 times since November, and just random little colds and flus. I haven't gotten COVID. I've tested, every single time I've been sick, and I've never tested positive for COVID. And, throughout this whole thing, I've never tested positive for COVID, but I just keep getting colds and sicknesses that'll last like about a week or two, and then I'll get over it. The last time that happened was in the middle of March. And so that was kind of a bummer, because that was about a week or so after I finished hyperbaric. Then I got a cold and then I got back over it. But I feel like my body's getting to the point where it's kind of, I can be around people again and have it not get sick, which has been nice, but I'm still dealing with the allergies and everything there.
So it was Pfizer vaccine you had originally, wasn't it?
Yeah, both doses were
You
Pfizer.
had both doses of Pfizer vaccine. Now, the background here, Carl, is that you are basically a professional athlete. You are
Yeah.
a champion mountain biker. I've seen your videos. It's pretty
Yeah.
impressive, and of course, we'll put a link. We'll put a link to that. Now, before you had the vaccines, did you have any allergies at all?
Not that I'm aware of. When I was a kid, I was maybe 11 or 12 years old. So I think it was like 6th grade. We moved into a new house, and I developed a little bit of asthma to the point where I had like a little inhaler that I would bring,
Yeah,
because I would have issues sometimes at that house, but then we moved to another house and it was fine.
and you're
So
okay. Yeah.
yeah, so I've never really had anything like that. but yeah, it's
Certainly
just,
no food allergies or insensitivities or anything like that.
no, no, nothing like this. I've never had my body feel so tight, and just, it feels basically like none of the joints want to work. And I just have a lot of stiffness and just really weak and fatigued. And it would happen. The worst for me, the worst trigger was red meat. So beef, especially if I ate beef within 20 or 30 minutes, I can just feel my body start to shut down. The only things that I tested that I was okay on were pork, chicken, like eggs, but not chicken, but just the eggs, milk, and then cashews. Those were like the four foods that I had no reaction to on my blood tests.
Anything
But
else?
pretty much everything else, yeah, wheat, pork, chicken, just all the different types of foods. And it got to the point where I was asking for so many tests with my allergist, and they were trying to go through it. They're like, how about we just stick to a bland, kind of a more bland diet and just try to work through without causing a trigger. But it's such a specialized thing too, right? Because I'm not getting anaphylactic shock, where I'm not like kind of having it convulse and really swell up in my neck or anything like that. It was just, as soon as I would eat that food, it would just send my body into more of a reaction. And
What do you
yeah,
mean when it makes your body shut down? What actually happens there, Kyle?
the biggest thing is it would just, my muscles and everything would just get really tight and rigid. And I would just kind of start to feel like an old man, to the point where I was just having a hard time moving around. And then again, like, it would kind of cause some of the issues with my chest. I would feel my heart. If I ate poorly consecutive days in a row, then I would feel like my heart would try to flare up again as well. So that was the biggest thing. And I mean, honestly, from July, August, September, October, November, and most of December, I was completely bedridden and never did anything, like just bedridden or at the doctor's, bedridden or at the doctor's. And then in December, after I started with the chromal and sodium, which is stabilizing the mast cells, and that seemed to help me a ton. And I would take that 3 times a day before every meal and then right before bed. But that helped me a lot. And after that point, I could actually start going on little hikes. And so we just got on like a little 1 mile hike or something and just try to get outside and be active a little bit, because it had been so long since I was able to be active. But in the last month or two, I've felt so much stronger. Ever since the hyperbaric ended, my body's just really responded well. And I mean, I put on about 10 pounds in the past month, and I think 7 of it was muscle, and I'm just able to like kind of come back. So I feel like my strength is coming back and everything's getting more normal. I'm definitely not perfect, but you know, I'm hopeful that as everything kind of sorts itself out in my body, it'll get better. So there is a lot of
Yeah.
hope. That
I
was,
mean,
yeah.
you were cycling like 100 miles a day, weren't you? I mean, when you were before the
I
vaccine.
have done 100 miles in a day,
Yeah,
but no,
yeah.
my riding was more of like 2 to 3 hours a day, or 2 to 3 hours 5 times a week. And then when we do the races, it'd be
And
bigger.
now, what can you do now?
Um, I mean, I've been kind of working back into it, but the most I've ridden so far has been like 3 hours of activity in a day. That was the most I've done so far. And then everything else is kind of like maybe 2 or 3 days a week. I'll try to get out and give my body 1 or 2 days of rest in between. So I haven't really done much where it's back to back. And even my fiance April and I, we just went on a road trip, and yeah, in between all the different days of riding, we try to take 1 or 2 days off. So
And again, going back to the vaccines, you got a taste after the, was it after the second vaccine you got the taste in the
yeah,
mouth?
yeah, and that was early on. You were the one who was kind of talking a lot about aspiration. And so I actually had a lot of positive response from that and from the interview we did together. And I had a few, like 2 different hospital managers that I know from the scene. They kind of contacted me and said that they changed their protocol with administering the
Yeah,
vaccines to
yeah,
aspirate. So if that was what caused it, then that was a big benefit from doing these kind of talks and talking about
sure.
it. But I'm not sure, like, it doesn't, personally, I don't believe it was solely because of the aspiration. I
Right,
think that could have been a part of it,
right.
but I did taste it. And a lot of the other people in our group did taste the vaccine, you know, kind of the more saline taste
And this
afterwards.
was like straight away. You tasted it straight away.
Yeah, like immediately upon
Yeah,
injection.
yeah,
So
yeah.
there was a lot of people in our group that share that. And by our group, I'm talking about the React 19 group. And that's basically a physician led research group with about 12,000 injured members in it. And so there's a lot of,
How many members? Sorry.
there's just over 12,000 currently.
Wow. Right.
And it's mostly Americans. And it's a physician-led research group. They've been doing a lot of great work, and that was one of the things. I spoke at the March Against the Mandates rally, and we kind of spoke about some fundraising opportunities for that. And they actually started a pilot program where they're helping people get hyperbaric or get IVIG to start healing. I guess the real goal, kind of the overarching goal with this group, is to start conducting a lot of research and compiling research that they can then go to the government and say, here's what we've learned, like, please help these people. Because that's been the biggest thing is early on when we were talking, and then even when I went to Washington, D.C. and testified a couple times, the goal asking for help, it's not just like, help me. That's not the goal. The goal is help us understand what's
Yeah.
happening.
Yeah.
And let's try to figure out how we can screen for this to avoid
Yeah.
it happening to other people, or let's figure out what we can do to get people back in their normal lives. And I have seen recently there's kind of more of an effort for long COVID research that's been dedicated to. And so hopefully, since these are pretty closely related, it seems, then we'll gain a lot of resources out of that. And then I don't know if the government's going to really want to do anything with more research until the emergency use authorization ends. And then I could see them dedicating a little bit more research to this. But right now, the pharmaceutical companies and the government just isn't really willing to help research it. They just don't want to look at the problem because there's no liability. And I mean, there is some research happening, but it's mostly this kind of stuff like physician-led research and, with React 19, and then even like the FLCCC, they've been working with a lot of people. So it's been interesting to see that. But everyone who has been injured or knows people that have been injured has kind of come together in this giant groundswell of grassroots resourcefulness and trying to figure out what treatments work and what don't. And I've had a lot of great doctors reach out to me and offer help, which has been amazing. So yeah, I can't thank you enough, honestly, for giving me the platform to talk about this. And it was really controversial last year when we started talking about it, and it still is to a certain extent, but I feel like people are coming around and they're starting to understand that this happens to people sometimes, and we need to do a better job of taking care of people and understanding why.
No, it's you that had the courage to talk about your suffering, Kyle, and you were very open about about the stress that was caused.
Yeah.
Difficult videos to watch. We won't go over that though. But
Well,
I mean, and initially, you got pain really quite soon after the second vaccine.
yeah, I had the taste immediately. And then I started to have kind of the heart palpitations and like my heart skipping and doing weird things about 2 weeks after. And so that was when I started to notice it. And then the big event happened just about 1 month after. So I think July 12th was my first hospital visit. And then July 16th was my second hospital visit where they actually acknowledged what was happening. And then we started going down that whole
Well,
path of trying to
and before that, of course, you were dismissed as being
yeah, just dismissed as, having anxiety or
yeah,
needing to talk to a therapist or a psychiatrist, because I
yeah,
had mentioned when I went in, in my mind, I've been this healthy guy for so long. And then I got this shot. And then a couple weeks later, I'm starting to have heart issues. And that's one of the known side effects is the heart issues. So when I went in, I said, hey, I'm not sure what's going on, but I think it might be a reaction to that. And then that basically was like an immediate red flag for them of, oh, this guy's crazy. And yeah, it sucked, but I wish I wouldn't have said anything. Honestly, I think that if I wouldn't have said anything, I would have been treated a little bit better at the first hospital. And then at the second hospital, I didn't really say anything until after they had run a lot of the tests. They're like, hey, we don't know what's going on. And then I said, I think it may be this. And they said, okay, that makes sense. But yeah, leading with that was definitely the wrong strategy going in.
well, at that time, I think one of the things this, I guess what you could say, publicity has done is make clinicians much more aware that this is a genuine
Yeah.
biological pathology. And there was many people at that time I talked to who were basically being dismissed as being head cases, whatever you want to
Yeah.
call it. And I think that stopped, and that's important. It's appalling that doctors did that in the first place,
Yeah.
but it's good to see that they don't do it now. Now, this POTS, I can never remember it, postural orthostatic tachycardic
Tachycardia.
syndrome. So
Yeah.
basically, when you stand up, your heart starts going very fast. Tachycardia, this very fast heart rate. Isn't
Yeah.
it?
So from what I understand of it, it's basically an imbalance between your parasympathetic and your sympathetic nervous system. And so the way the doctor explained it to me is like when you go to stand up, your brain and your sympathetic nervous system is basically saying, okay, we're standing up and we need to regulate things. And the autonomic nervous system is supposed to regulate your blood pressure and your heart rate and get
Sure.
things to kind of work in conjunction. But when there's a dysfunction, it doesn't really know what to do. And so the biggest symptom is like going from prone position to standing. When you do that, your blood pressure is supposed to increase a little bit just to help your body function, and it doesn't do that. And so you'll just black out. And that was kind of the biggest thing. And then for me, I would be at 120, 130 heart rate, just walking around trying to cook breakfast in the morning, doing anything. And now, like even now, my heart is so much better, and it's 58 to 60 beats a minute. And if I'm making food or anything, it's maybe 75 or 80. So it's come so much in that over the past year. It's gotten so much better, which has been awesome. But there was definitely a few months where I was pretty hopeless and didn't know what was going to happen. And I think that was, you know, you're referring to some of the harder videos, but the hardest thing for me was when we went to Washington, D.C. the first time and went and testified in the Senate. And there was a lot of people that didn't show up who, you know, should have at least sent a representative to listen to the injured people, because there was 10 injured and then there's 10 scientists and doctors who were testifying as well. But yeah, it was just heartbreaking to see that they didn't really want to question or see what was happening. That was the hardest thing for me, especially one of the girls that was with us and is part of this group is this young girl named Maddie. And she's 13 years old and had a really bad reaction and has been in a wheelchair since December of 2020. And so, or January, I believe. But with her, watching her go through all the things she's been going through and, you know, racking up tens and tens and tens or hundreds of thousands of dollars of hospital bills and dealing with this. And it's a 13-year-old girl. Like, you know, it's just someone you should be trying to protect as a society. And we should do our part to try to do that. And that was, it really broke my heart a lot to see that. And then just to deal with the pushback of speaking out. And I think so many people wouldn't listen to the full message and they would just kind of pick and choose little sound bites of what they wanted to hear. And so, I mean, my full message this whole time has been, you know, I feel like the companies involved or the government should set aside some funding to help research and heal the people that are being injured. And if it is such a small percentage of people, if it is less than 1%, or like some people say 1 in a million or whatever they say, if it is such a small number, then that's even more of a reason to help. You know, if they're making $60 billion in a year, then they should be dedicating some resources. But there's a lot of bureaucracy that has gone on with the emergency use authorization and a lot of the different governments around the world giving the vaccine companies immunity. And so I think there's a lot of inherent like kind of roadblocks that we're fighting and kind of bashing through. So I'm hoping that in the future that'll get better, but it's been a learning experience. And I never thought that government was as corrupt as you always see on TV and on movies. And then when you go there and you actually spend time there and talk to these doctors that are trying so hard to get through to them, and even React 19, they've been working, I guess this week is the 1-year anniversary of them working with the government and the NIH and the FDA. And it's just like, nothing's happened, you know, it's been a year. So we're trying so hard to move this needle forward, but I don't think they're going to do anything until the EUA ends, the emergency use authorization. And I think once that ends, then there may be some help and, you know, just some studies, but I'm one of the lucky ones. And I'm hoping that there's going to be more lucky people that can get through this and be okay. But early on, we didn't know what was happening and the doctors didn't know what was going on. And so you're just kind of in the dark, laying in bed and not knowing what to do and how to talk about it to people. And yeah, it was just really tough.
Well, you felt your life was in danger, didn't you? I mean,
yeah, for sure.
That's the bottom line, and certainly, I mean, your career, your income depends on your physical fitness. And
yeah, and there's been a lot of people I've met that have had similar circumstances where they've lost their job or they've racked up a lot of hospital bills, and it just sucks because I mean, life isn't fair a lot of times, right? But it just sucks when you're told this is going to help protect you and your family members and the people around you, and it's a good thing to do. And then when it goes sideways and then it becomes, you know, you lose thousands and thousands and thousands of dollars and you lose months of your life. And some people lost their life from it. And so it's just a hard pill to swallow. And I mean, I grew up on welfare. And so I always kind of trusted the government inherently. And, you know, some people will take that for what they think, but, you know, my mom was struggling a lot when I was younger. And so we were on disability and food stamps and all that kind of stuff. And so I've always thought that they kind of had our best interests at heart. And then going through this, it just surprised me at how little help there has been. But I'm not just saying, hey, give me money to help me. It's not that. It's just, let's figure out what's going on so that we can try to avoid this in the future.
And that we want the transparency, not just the ordained narrative.
Yeah.
We want to be able to ask questions and have those questions answered in an honest way, not just you sit at our feet and we'll tell you what's good for you.
Yeah.
Sort of approach.
Yeah,
there is a kind of consistency to what you're saying here in terms of the pathology card. But before we do that, can you just tell us about the hyperbaric oxygen therapy? Because I've never actually been involved in this.
Yeah, so I mean, I'm not a specialist at it by any means, but the reason that it piqued my interest, I experienced it. So the reason it piqued my interest is that there was a group of doctors, Dr. Bruce Patterson and Dr. Yo, and they run the COVIDlonghaulers.com. So they have a big protocol around COVID long haul. And so they actually took my blood and they scanned it to see if there's any spike protein present in my immune cells. They did spectroscopy where they shoot light through it and they can sequence and see if there's how much spike protein is in your immune cells actually. Because they have, I'll let you dig into that a little bit more, but they have a whole thought process on what's going on and that the spike protein is getting stuck in the monocytes. And so I reached out to them and they kind of helped me with that. And then we actually did the scan and saw that I had 0.03% spike protein in my monocytes. So I had almost no spike left. And so that meant that what I was dealing with was kind of like the systemic inflammation, a cytokine issue or an interleukin issue, which are pro-inflammatory proteins. And so when we were starting to look at that, they have a protocol that they give people, which helps with separating the spike out of the monocytes and getting people back to a point where they can start healing. And since I had no spike in my system, we were looking at what we could do to try to heal this inflammatory response that I was dealing with.
So it's almost like there's two groups of patients. There are those that are retaining spike, and there's those which are suffering from the inflammation that presumably this spike protein is originally triggered.
Yeah, either that or even a third group of people that are allergic to an ingredient in the vaccine itself. So maybe they have an allergy to the ethylene glycol, or they have an allergy to the lipid nanoparticle, or they have an allergy to some of the adjuvants that are in it. And so there's a lot of different things, and it's kind of hard to pinpoint exactly what's going on. But with COVID long haul guys, they seem to have a pretty good way of checking and seeing what's going on and at least ruling some of it out. Because if there are some people that have quite a bit of spike protein still in their monocytes, and if spike is cytotoxic, that's still a big question, I guess, that needs to be fully vetted. But if spike is cytotoxic, then that can cause just systemic cell death.
Well, spike is antigenic, and that will therefore cause an inflammatory reaction to that presence of that foreign material.
Okay.
So this spike is present in people a long time after vaccine, as well as people that have got long COVID.
You should have Dr. Patterson on. I think that you would really enjoy an interview with him. But talking to them, they told me that they have seen spike protein present as long as 12 to 15 months post vaccination, and even that's what long COVID is in their eyes, is the spike staying and getting stuck in the monocytes and is causing the systemic issue. So that's their thought process. I'm not a doctor by any means, I'm just, that's one of the groups that I did work with, and they helped me by kind of checking that out. And then when we realized it was more of the systemic issue that's not spike protein related, then we started looking at therapies. And two of the leading therapies that people were trying were IVIG and hyperbaric oxygen therapy. And apparently with the hyperbaric, basically it's a pressurized chamber.
Yeah.
When you're breathing the oxygen, it actually forces your blood plasma to carry more oxygen. So normally just your hemoglobin, like your blood cells, can carry oxygen. And then when you pressurize it, you can actually get the oxygen into the plasma, and then you can kind of create this healing cascade.
The plasma does carry a little bit normally, but if you increase the pressure and increase the proportion of oxygen, you would increase the amount of oxygen actually in solution in the plasma. That seems to be what's happening.
Yeah, that's how I understand it. And some of the numbers I've heard have been anywhere from like 500 to 2000% increase in oxygen.
Wow.
So it's quite a bit. And I think one of the other common issues that people seem to have, at least, is mitochondrial dysfunction. So their mitochondria isn't functioning properly. And that's why partially they're having this kind of mass fatigue syndrome. And so for me, that was one thing I noticed a huge difference with through the hyperbaric, is my body really started to kind of have more energy and kind of recharge a little bit better than normal. And it also felt like it calmed down a lot of the inflammation that I was dealing with. So I would say that if I was 60% going into the hyperbaric and I was able to have an okay quality of life, but I was just bedridden, and then I would kind of go back in bed if I started to do too much, and I was kind of on this roller coaster of feeling good and bad, the hyperbaric brought me up to about 85%, and it just leveled my body out. So I feel good most days now, and I don't really have those down days as much.
Yeah, the effect of the hyperbaric lasts forever after the sessions, does it? You improve long term.
That's the idea, and that's kind of why I wanted to wait a little longer to chat with you, because now it's been almost 2 months since I had my last session, and I still feel really good. Aside from that flare I had, 2 weeks ago when I overdid it, my body feels like it's healing and feeling really good as still. So that's been really great. But yeah, the hyperbaric, there's two kind of hyperbaric systems. There's a mild hyperbaric, which is a soft shell chamber, and that one is usually up to 1.3 atmospheres. Some of them go up to 1.4. And then the hard shell chambers go 1.5 and up to 2.4. A lot of times as well with the mild hyperbaric, it's not full oxygen you're getting. Some places even just use room air. And so it doesn't seem, from the anecdotes we've experienced, and even myself, I did 4 mild hyperbaric sessions and I didn't notice a huge difference. And then once I did the hard shell hyperbaric,
Right.
you need a nurse to be there to like monitor it. And, you get your blood pressure checked every time, and you get grounded so you don't cause a static shock and ignite the
Yeah,
oxygen. So
yeah.
it's pretty serious treatment,
You're
but
not
it's
allowed to smoke.
non-patented.
You're not allowed to smoke when you're in the chamber, I guess.
No, definitely not. But, and for me, the cost on that, I tried to get my insurance to help me with that, but since there's really no protocol of what this injury is, there's no protocol on how to treat it. And so we were able just to pay for it out of pocket, luckily, but it was $200 a session. And then I did 5 days a week for 8 weeks. So it was about $8,000 to pay for that, but it totally gave me my quality of life back. And I was able to start working out and riding and everything. So it was well worth it. But going into it, it was really nerve wracking. And the reason that we decided that would be a good treatment to try is that I do have a history of concussions and head injuries from mountain biking in the past. And hyperbaric, there's a lot of studies showing that it helps with that. So I kind of figured worst case, it would help with that. And best case, it did 2 birds with 1 stone. So that's why I tried it. But ever since that, I've had a lot of people, like, dozens of people reach out and say that they tried it as well, and it's been helping them. So it does seem to have some efficacy.
What you're saying here, it actually does make a little bit of sense. So we have these lymphocytes that you know about, the T helper lymphocytes. They're not to be confused with the T cytotoxic lymphocytes that actually kill cells, but the T helper lymphocytes. And some people are saying that they produce 2 groups of cytokines, these cell hormones, the Th1, the T helper 1 and the T helper 2. And without going into too much detail, it's the T helper 2 group of lymphocytes, or the T helper 2 type of T helper cells that produce the immunoglobulin E, or stimulate the production of the immunoglobulin E, rather. And that's the one that's evolved in allergy and severe allergic reactions. So
and that's kind of what I have.
It looks like you've started producing IgE when before you didn't, because your levels of IgE are high, and it's the IgE that predisposes you to the allergies.
Yeah, so I think that it triggered something in my body where it just kicked off this big, kind of cyclone of cascade of problems. And for whatever reason, the IgE, like I said, it was in the high 800s, and now it's kind of in the low 600s. And I just drew blood again this past week, so I'm hoping to see that it's trending down again. But I don't have any labs or anything from before this happened, because I never really dealt with any issues.
No, but you had no symptoms though. You didn't have any allergies to food, so there's clear consistency. And the other thing there is these T helper cells, the type 2, is also increased the eosinophils, which you described, which are cells which are increased in things like asthma and parasitic disease.
Yeah, and that's the 2 things that I've kind of consistently tested really high for. And a lot of the other people in the group that have similar symptoms to me, they also have really high elevated IgE level, and they have a high eosinophil level and mast cell activation syndrome. So like I said, it's weird because it kind of kicks off these different sets of symptoms, and some people
but they are all consistent.
Yeah, there's a lot of consistency within them. And some people develop the neurological issues, which seem to be the hardest ones to deal with, because it just causes the tingling and burning of vibrations and, the internal vibrations. And so that one seems to be the hardest one to deal with. And most people that are experiencing that, they're going down the route of IVIG. So intravenous immunoglobulin, that seems to help them the most, but it takes about 3 weeks for it to wane. And then you just have to keep doing it. And it's, from what I looked at, it was around $2,000 a treatment. So it's quite expensive as well,
indeterminately into the future.
Yeah, exactly. And that it doesn't seem like a long lasting effect so far. And I have several friends that are doing that right now, but they go in every 3 weeks and get their IVIG, and it seems to help them a lot, especially with neuropathy and the burning sensations. And then it'll kind of wane and come back. The hyperbaric, on the other hand, it doesn't seem to help with the neurological issues as much. It's mostly the people that are kind of like me, where they're dealing with the mass fatigue and kind of this mitochondrial dysfunction, and they're dealing with a little bit of like POTS, the dysautonomia. So I felt like it completely resolved my POTS symptoms, but it's not like it fixed my pericarditis. It just, the pericarditis was gone, but I was still dealing with POTS, and I was dealing with this allergic response, and it helped the dysautonomia. So
yeah. And the other thing that's consistent is it's the immunoglobulin IgEs, which stimulate the release of histamine
Hmm.
from the mast cells. So the mast cells are like all over the body, and they store histamine. And when you've got these IgEs, which shouldn't be there, they're boosted when you have a food that you're now allergic to. And that's going to cause the mast cells to chuck out a load of histamine. And it's
Hmm.
the histamines which can cause these inflammatory allergic reactions. So if you take a drug that stabilizes the mast cells, even though the IgEs are there, the mast cells aren't going to be chucking out as much histamine. So,
Yeah,
so you're
exactly.
not going to get
And
as
that's what
many.
this is.
Yeah, yeah. But
Yeah.
of course, ideally, you would want to reduce the amount of immunoglobulin because you're not supposed to be producing that immunoglobulin type E.
Yeah.
This seems
And
to be.
a lot of people will take H1 and H2 blockers for histamine, and that seems to help as well, but it doesn't really address the root
They're
of the problem.
antihistamines, aren't they? Yeah, yeah,
Yeah. Yeah,
yeah.
so it's been interesting. I think that's kind of the most interesting thing is seeing how many of us are really similar. And I don't know
Mm,
the different mechanisms at play. Obviously, I'm not a doctor, but it seems like some people are reacting to the spike protein negatively. Some
mm,
people are reacting to the lipid nanoparticle or something in the vaccine itself negatively. And
mm,
then the ones that are really similar to long COVID, it seems like that would be more of the spike protein effect because that's the shared common component right there is you have spike on the virus and then spike on the vaccine as well. But again, I'm not a doctor. That's just kind of, I'm working with all these different doctors in this big group and everyone's kind of doing their best to bootstrap it. And ideally we'd have like this government funded research
oh,
program
heck,
that would be dealing
yes.
with it. But,
Absolutely. I
but
mean, the government authorised this.
yeah,
It should take some responsibility for this. But this is making sense, and that gives me a lot of hope that the medical fraternity is at least going to come to understand what's going on.
mhm.
How that translates into effective interventions, of course, is a slightly different thing.
Yeah, I have a lot more hope as well now. And I think that's been the biggest thing. And that's what we're trying to do now is there's so many stories of people that were injured and there's so many stories of people that were dealing with all the hardship of this and getting pushed back online and social
Mm,
media. And I think now we're trying to turn this corner and say, hey, there's a lot of us are starting to get better and we're starting to have, quality of life again and things are getting much better. So you have hope and don't give up. And I think that's the hardest thing is
mm,
there's still been a really high suicide rate in the React
mm,
19 group. And
mm,
I mean, just a few weeks ago, we lost a 20-year-old male who, had to get it for school. They required 2 shots. He had an adverse reaction after shot one, got kicked out of the program at school, went to live at home with his parents, and was just so devastated by all the issues with health and then all the issues socially that he ended up ending his life. And we're seeing that happen, like, in this group, at least like 5 to 6 times a month, it seems like people are still killing themselves. And it's just sucks. It sucks because it's, I understand like how hard it would be, especially with the neurological issues. And I could see why they would just want relief at some point. But we're hoping that we can get to the point where there's actually programs in place of here's how we can try to mitigate that and reduce the symptoms and reduce the pain. And just, we want everyone, whether you have COVID or whether you have post-vaccine injury or anything, we just don't want people to suffer. We don't want people to die. That's kind of the end of story, right? Like we want people to have a good quality of life. And I think that that's been lost in the narrative quite a bit, and it's just like even the way people interact and talk to each other now, it just sucks to watch people divide each other so heavily over something that most people don't understand. And I had no understanding of it at all going into this and just had this injury happen and then spent the last 7 months like talking to all the best doctors that are involved in this field. And I still don't understand it all the way, and we're still learning stuff every single
mm,
day. And
mm,
one of the most recent things is people are testing their gut biome,
mm.
and with long COVID and with post-vaccine injury, a lot of them have really messed up gut biome, and it seems to affect the bifida bacteria the most.
Mm.
So that's something that's really interesting, and there needs to be more studying done on that. But like you said, I'm hopeful that more people will be able to like kind of contribute and help research this, and we can get to the point where people are healing and stop suffering. But
What gets me actually really quite angry about this is people who've had a vaccine response or an adverse response are still under pressure to get another vaccine dose
yes,
from the system. I mean, the idea that we would not, the idea that we're treating everyone the same is just the antithesis of this individualized evidence-based medicine that we're supposed to
yeah.
be practicing.
Well, and I
And
mean, someone put it pretty bluntly. They said even if you mandated peanut butter, tens of thousands of people would die.
absolutely,
So it's like, that's why, I spoke at the March Against the Mandates, and
Mm.
it's not because I'm against everything involved.
Yeah.
Like I've even said in my speeches,
Yeah.
I'm not saying to end the vaccine program by any
Yeah.
means. I'm saying we need to dedicate some research to, like, some of the funding, some of the billions and billions and billions of dollars companies are making needs to go to helping the people that they're hurting. So
Yeah.
especially when you promise safety and then you give them an
Yeah.
injury. So
But the fact that governments and things and a lot of employers are saying, look, you've had a vaccine injury that, or an abnormality the first time, hey, you still got to have a second one. I mean, that's just.
yeah,
And as you rightly say, I mean, we're not. I mean, what is $1 billion? It's $1,000 million, and we're dealing with tens of billions of dollars that people are
yeah,
making out of this. Surely there's some moral imperative to try and
yeah,
research and understand your product, and the
yeah.
fact that
We've
that doesn't seem to be happening is.
Yeah, with the React 19 group, we've started this kind of pilot program where we've raised around $500,000, and basically it's split up into 50 scholarships. So there's going to be 50 people roughly who get around $10,000 to help with treatment, because that's kind of what it seems to be, is whether you do
Yeah.
5 courses of IVIG or you do hyperbaric, then it's around 10 grand. Like that was my treatment, was around 10 grand as well. So, we were talking about it, and with 12,000 people in the group, if everyone just needed, like, even if it was just 10 grand and then it fixed everyone, that's still over $120 million of support needed just in this one group of people. So it's,
But
I mean, that's what they're
that's
making almost a
peanuts
day.
compared to the tens of billions of dollars that the pharmaceutical industry is
Yeah.
making out of this. I mean,
Yeah.
just astronomical amounts of money, and
Yeah. So I don't know.
they
It's
seem
hard.
happy. They're doing research now on new vaccines.
Yeah.
But
Yeah.
why don't
There's
they
a
do
lot of,
research to clean up the mess they've already made? I just find it infuriating.
how have
And
you,
I haven't suffered the way you have, so it must be even
yeah,
worse for you.
I think the hardest thing, honestly, has been the public scrutiny and the public pushback. I think that's been on top of all the health issues. Like speaking out was basically just this massive amount of collateral damage. And I think, like I said, a lot of people would assume what my message was or assume what I was trying to say without actually listening. And at the end of the day, all I'm saying is you can't do this to people and not help them. It
Yeah.
doesn't make any sense. There's nowhere in the world where you should be able to sell a product that injures people and then not help them figure out what's going on.
Yeah.
And like I said, I'm not even asking for money to just
No.
help. It's like, just help us understand it. I'll fix myself. Just,
Mm.
like we just need to know the mechanisms at play. So
And then if people say, "Oh, I'm not going to bother doing that," then the government say, "Oh, okay, you don't want to bother. Fair enough. Let's go and have a game of golf." I mean,
yeah.
where's the governance here? It's
Yeah. How has this experience, like with all of you going through this past pandemic, how has it changed your view on public health?
well, I think a lot of people have become just as you have, so cynical, so disillusioned about government, about big finance, about big pharma. The fact that they have this single narrative, and we're basically not allowed to disagree. And
Mm-hmm.
I think we can do what we're doing now because you're describing your experience, and that's right by definition. It's what you're experiencing. But where is the official acknowledgement that this is a problem? Where is the caution that this should engender? Now the risk benefit analysis has completely changed. So in the dark days of Delta, when a lot of people were dying, you can see
Yes.
that there was a public health emergency. Now, to be quite honest, I see a public health problem, but
Yeah.
I don't see a public health emergency that carries on meriting emergency use authorization. We should have the full trials now before we carry on doing this. And in quite a few of the pharmaceutical products, whether it's antiviral or whether it's vaccine, we simply don't have that full authorization.
Yeah.
And I just don't think we're in an emergency anymore. I think governments and industry needs to move with the times. We are where we are today, not where we were a year ago.
Yeah.
And
I think that's the hard thing too, is
just so disillusioned. We kind of like to believe in our governments and our representatives, and
yeah. Like I
but
said, I grew up on welfare, and I always had this thought that it was just there to help and support people and give people a second chance. And I mean, without it, like we were homeless at a point, lived in an abandoned house. Like I had the whole 9 yards. Like my life could have been so different without government assistance. And because they helped, I was able to get an education and kind of make a career for myself and try to help a lot of other people along the way. But I don't know, it was really shocking going through this. And then what was really sad too is I asked one of the politicians in DC, I said, what's it going to take? Like, what's going to happen for this to get kind of blown open and for this to become an actual issue that people care about in the politics? And he told me it doesn't matter who's running it right now, if it's Republicans or if it's Democrats, like whatever administration it is currently. He said it just needs to switch. And as soon as it switches, so it's Democrats now running it. If it switches to Republicans, then the Republicans say, oh, look at what a mess they made, and they'll try to clean it up. And if it was Republicans now, then when the Democrats come in, they'll say, oh, look at what a mess they made. And so that was what his answer was. I don't know if it's true or not, but it's just frustrating that it works that way, where it's like, how can we make them look stupid and address this problem that's out there now? But I don't know. It's just, I appreciate you a lot, John.
It's a scientific problem, isn't it?
Yeah. And I mean, there are a lot of doctors that are really well respected working on it. And they're risking everything to work on this and try to help people. And some of them have been the ones that have helped me the most, and the people like the FLCCC group and Dr. Patterson and Dr. Yo and all these different people, Dr. Merrick and Dr. Cole, like these are the people that have been actually helping and getting it to the point where I have my life back. But I don't know if I would have just done nothing, what would have happened. I don't know if it would have gotten worse. I don't know if it would have gotten better. I don't know. But I will tell you that by doing these treatments, it accelerated my healing a lot. And I felt like I just went on this roller coaster up, and I've been feeling better and better now. So I feel like I have my life back, and I'm maybe not 100% still. Like I still have a little bit of fatigue, more so than I used to. And my heart still does a few weird things, but it's so much better. And I'm so grateful. And I don't know, I appreciate them risking their careers to speak out and try to just help us understand this. And if they weren't,
some of the names you mentioned there are the leading doctors in their fields in the world.
Yeah.
I mean, these guys of this caliber take the time to treat you as an individual is really quite.
Yeah. And I mean, even, quite moving, Dr. Really. Merrick, especially when we were in DC, for this March Against Mandate speech, we all wore a name tag with the brand that caused our injury. So someone had Pfizer or Moderna or J&J or AstraZeneca. Yeah. And so Dr. Merrick came into the hotel that night, and Maddie, she's in her wheelchair, at the end of the night with her Pfizer tag on. And Dr. Merrick looked at her and just like broke down crying and is like, what are we doing? What are we doing right now? How are we doing this to people? And what is happening to the point where there's little girls in wheelchairs and it's not being acknowledged? And she was actually in one of the trials. So it's like, we cried together. And, when I see someone like that, who's willing to just break down and cry because of this is so messed up. And you can see that in person, like that's someone who cares. He doesn't have another agenda he's trying to push. He's just trying to help, And so when you look at someone like Fauci, who's not even willing to show up to a meeting or send a representative, it makes me feel like he doesn't care.
Well, I don't think he's treated a patient in 40 years, has he?
Yeah. So it's hard to listen to those people. And especially when they tell you not to listen to the other ones who are actually, trying and risking their career on this. And I think that's been something that, it's been cool to see the courage of the doctors that are speaking out. And I really appreciate them. And I don't agree with every single thing they've said.
No, of course.
You shouldn't with anybody, but I really respect them for putting their life on the line and their career on the line to do this.
But if you look at Dr. Merrick's publication record, it'd be a pretty arrogant person who didn't listen to someone of that caliber. So.
Yeah.
I think he's had more publications than any other doctor in the world.
He's pretty amazing. I don't know.
Incredible.
They're working on a vaccine injured protocol as well. The FLCCC is. So they're going to have something coming out soon, and hopefully that'll be at least a place to start. It's pretty dense what they're working on. And I think the goal of it is to be able to go to your doctor and say, hey, here's some research and here are some of the things that people are doing. What can we do? And so I don't know, at the end of the day, I hope that the contribution that I made in any way is just by kind of raising awareness and hoping that people can understand that it's not just like total nut jobs that are, dealing with this. Like there are a lot of people that are faking it and doing GoFundMe's and trying to fake these injuries. And there is some of that is happening.
There is.
And you can't ignore that, because that is a truth, is that some of that is happening, but there is a large portion of people that are injured. They feel alone. They don't know what's happening. They don't know how to get better. And they're just giving up hope. And a lot of them are committing suicide because there isn't really this protocol yet of what to do. So I hope that anyone that is injured just hangs in, and you'll get better, and you'll you'll make a big comeback. It's yeah,
And there is biological proof of this. I mean, if we take your case, you've been formally diagnosed with pericarditis. You can see that.
yeah,
You've had raised troponin, so there was some myocardial injury. You have had high eosinophils. You have had very high immunoglobulin type E's. You can't fake these things. This is
yeah,
pure rock solid pathology.
yeah.
It's,
And I was able to get a doctor's note from both my primary doctor and my cardiologist saying that this was because of the Pfizer vaccine, which was really hard to do. But it's funny because the day that I went and I got that doctor's note from my primary care physician, she wasn't actually able to write me an exemption because
yeah,
of
that's
the
just
hospital policy.
that's exactly the sort of thing I was getting angry at just before. The idea that doctors aren't allowed to be doctors anymore.
Yeah. So I don't know. It's been crazy, man. And I really, really, really appreciate you. And I think that you've done a huge service and just giving people a platform to speak on it. And I owe you a huge debt because without you and without that first interview we did, these people wouldn't have taken an interest in helping me and getting my life back. And so I really appreciate it, John.
Yeah, but it's you that showed the courage to talk about your suffering, Carl. That's not always easy.
Yeah.
Yeah, yeah. So now, what are you doing? Are you making videos? Are you
Yeah. Yeah. Just trying to
riding?
get back to normal life.
Yeah.
I'm hoping, I think
Watch Carl's videos. They're really good. No, seriously, they are. Lads.
I'm hoping that we can get back to kind of a normal life. And honestly, I think the biggest lingering symptom is just the trauma of kind of just going through this whole thing, and it's been really tough. Like I dealt with quite a bit of depression this past year and, anxiety, and now I have a lot of social anxiety. And I mean, it's weird. Like 8 out of 10 people are just super awesome and super supportive and kind and just really genuinely happy to be like, oh, you're getting back. But
Yeah.
I have 2 out of 10 people that just look at me with pure hate because I spoke out on this and they think I'm against whatever they believe in. And so that's been tough. Like I've never had that really. I mean, I'm sure there's people that have disliked me and I'm sure there are people, but it's just been weird to feel that. So I'm just am trying to get back to normal and hopefully people will see that I'm just a normal guy and just trying to, this was just an experience that kind of got sucked into.
I mean, basically, you had the courage to stick your head above the parapet, and that means that some lunatic's going to shoot at you.
Yeah, it was.
But if you look at the comments you've had in the past, and I think we must be on about 30 or 40 or 50,000 comments now just on the videos.
Yeah,
I mean, I would say that are more than 99% overwhelmingly positive.
Yeah, and I think that
people aren't stupid. They realize the real thing when they see it, and and you're clearly describing that. There's no.
Yeah, and I'm hoping that I'm still hoping to kind of keep a foot in the water a little bit with helping advocate for these people and advocate for the other injured people, and especially with react19.org. That's the website, but it's
so we'll obviously put all these links that people can click.
Yeah, they're kind of the ones. They seem to be the ones that are making the biggest push, and I'm not compensated by anybody. I don't work with anybody or anything like that. It's just, they've been the ones that have helped me the most. And actually after the first video that we did, Brianne from there reached out to me and said, there is hope. You're not alone. This is what we're doing. And so I think,
and we can give that message now to people with long COVID or to people with vaccine injury.
Yes, definitely.
There is hope. You're not alone. Research is being done. There's help groups. Talk to people. Join a group. Get involved.
And if you're a researcher,
there's buddy systems. There's all sorts of things that can people can be put in contact with them. We'll put the links to that, obviously.
Yeah, and if you are a researcher or a therapist, and you feel like donating some time to people that are injured, the React 19 group is willing to, onboard people and help out. And so I posted a pretty emotional update in November, just after that DC meeting.
I was actually really quite worried about you when I saw that. That was
it was.
Yeah.
It was not a good time, and it's just like I was embarrassed to share that, and I think
not at all, not at all. You had the courage to show your emotion. I admired it. It was concerning. It was concerning, but I admired it.
Yeah, I guess kind of my goal with sharing that was I just wanted to show people that it was a real emotion. It's not a fake thing. This is actually how I was feeling. I was driving to the doctor's office and just broke down because I was getting bullied by these people nonstop, and you block them and then they come back with new accounts and bully you. And it's so funny because it's just interesting to see like the people with the I'm vaccinated labels on their Facebook or Instagram just bullying the crap out of us. And it's like, I thought you guys were supposed to be, the more kind side. And it's just been kind of funny to watch that. But yeah, I was really heartbroken just about what's happening
I
to the
would say
people
more
in the group. And
pathetic than funny, but yeah, I know what you mean.
yeah. And so that was really hard. But after that post, within that week, about 25 therapists reached out to the group and they offered free therapy, and they intervened in 12 suicides just in the next month. So it made a difference showing that emotion. And that's why it's worth it to get beat up on. Like, I don't really care what people say online. Like, it does inflict wounds, but it's not like the soul doesn't care. It's like, it does inflict little superficial wounds, but it's worth it when it makes a difference. And I'm hoping that even with this, it'll just give people some hope to hang on. And if they can afford to try hyperbaric, then I think that's a great modality. And there's a lot of other simple things that you can do. I'm really hoping that once this FLCCC protocol comes out, there's a lot of simple things on there, just like upping your omega-3 count and, taking probiotics and doing vitamin C and eating, a certain type of diet, and really experimenting with your food a lot. It seems like so many of us have food triggers. And
We are
I
looking
just hope,
forward to this protocol. It's not out yet because they're doing a very thorough job of researching it.
yeah,
But obviously, we'll be reporting on it when it is officially published. But it's not
yep.
quite there yet.
So no, I hope that we can give people hope. And I don't know, I just, like I've said it a bunch, but I just really appreciate you, and I appreciate the opportunity to do this. And I hope it helps some people along the way.
No, thanks, Carl. And now, if do leave comments. I know Carl managed to respond to several hundred of them last time, which is really quite admirable. He might not be able to respond to all of them because there's only one guy, same as I am. But we will put the links to these organisations, and they will get in contact with you. And there is liaison there, so don't suffer in silence.
Yeah, whether it's long COVID or
you are.
any of the vaccine stuff, I think that's the big distinction. Is suffering, no matter what it is. And if there's some shared mechanisms that we can kind of help work on together and just try to figure this out, then that's great. And
sure,
I don't know, it's just
and if you are feeling really particularly down, even feeling like there is a risk that you'll hurt yourself, then just bear in mind that in itself indicates that the mind is imbalanced, and illness can do that to you.
Yeah.
But you do get better.
Yeah.
I was a psychiatric nurse when I was young, and I've seen people in depressive stupors. They can't do anything, but they do get better.
Yeah.
And they walk out, and they do go back to normal lives. You just have to sort of hang in there, but don't keep it to yourself. Share it, tell people about it, tell people around about you, join these help groups, get professional help. Just start talking about it until someone comes along and gives the help that you need as an individual.
Yeah. And I just want to say thanks to everyone who's helped and supported me as well. Along with the negativity, there has been so much positivity, and especially after I kind of pulled away from social media for a couple months there.
Sure.
I mean, we were getting like people sending stuff in the mail and just nice letters from all over the country. And it was, I don't know how they found my address, but it was pretty cool to see that. And I don't know, just people are so kind. And I think there's so many people, a lot of people that watch these videos and don't leave a comment. That's the majority of people. Right. And so I think that it's just interesting how kind most people are, and how many of us are in this kind of area where it's like, I don't know what's happening. I want to be able to trust somebody. I don't know who to trust. And now it's like the government is giving you so many reasons to really not fully trust them. And then you don't know who to trust on the news. And then you have like these independent bad actors. And I think one thing that's been hard is getting tied in. Like, we basically gotten pulled into this whole argument of like the really far right conservative anti-vax group. And it's just interesting because not all of them are the same, but there is a portion of them where it's literally they're selling books and making money and selling t-shirts and selling this merchandise based on this whole thing. And I think that people don't realize necessarily how much gain there is to be had from selling a narrative. And it sucks because it's like, you don't want to really rely on people that are selling this narrative, whatever side it is, because they have a financial interest. And so, I mean, that was one thing that we tried to be really cognizant of, especially during my whole injury, was like not doing a GoFundMe, not really advertising it, not doing a whole lot of merch. Like, there's nothing that was a financial gain. It's just, I'm speaking out because it felt like the right thing to do. And I just was so desperate to get help and to help others. And that was why we spoke out. So I know a lot of people combat it and say, oh, you don't know what you're talking about. But I mean, I have no reason to do this I have everything to lose and nothing to gain. And so that was kind of,
Correct.
along with the React 19 people, it's just people that were injured that are just trying their best to figure it out, and there's not
Yeah.
really anything to gain. So,
Which I agree with 100%. But I would say if you want to watch Carl's videos, then please do so.
yeah.
If you ride bikes, they're great. And let the adverts run as well. That doesn't do any harm either. That just
But yeah, and I guess just try to treat others as you wish to be treated, and respect other people's opinions.
Absolutely, Carl. Yeah.
Well, thanks, John.
No, thank you, Carl, and you've shown great courage as always. And do come back. I mean, anytime you want to come back and tell us how you are, of course you're welcome. And we're looking forward to this new FLCC protocol.
Yeah, I'm really hoping to kind of turn the page on this whole chapter. So
sure,
I would love to stay in contact
that.
with you, but I
understand that completely. You've done more than your share. That is for sure.
Yeah, that's the goal. But
yeah,
thank you for everything.
Carl, thank you very much. Great to talk to you again. Right.
Bye.
Thanks. Bye.